Hello, Fairfax County parents and community members. This is Dr. Brabrand, Superintendent of Fairfax County Public Schools. Thanks for joining our town hall tonight. We're so glad to have you here, and we're excited to take your comments and questions around return to school. We shared a lot of information yesterday with the school board at the school board work session, and we'll be doing another school board work session early next week with additional information. But we are so glad to have you here tonight. First of all, I want you to know that I am joined tonight by Assistant Superintendent Jeff Plattenberg. He is our Assistant Superintendent for Facilities, and we're glad to have Jeff here. I'm also joined by Lorraine Troughton, who is our Manager for School Health Services. And Lorraine, great to have you here this evening as well. We've been working very hard to bring to you our collective best thinking around return to school. I do want to share with you something that we talked about at the school board last night. We, in a perfect world and under ideal conditions, would have all of our students back, 100% of them, on the very first day of school this coming year. The reality is, in this pandemic, we are having to come up and bring our best thinking under less than ideal situations. So we are continuing to work and innovate and think and work collectively with you to bring the best thinking, the best solutions to serve our students, our staff, our families, and frankly, the entire Fairfax County community. I want you to know we just received, as many of you are already aware, updated guidance from the Governor of Virginia and from the Virginia Department of Education, the Virginia Department of Health, around how to do return to school. And we have been using that guidance as we've been developing the scenarios and even the presentation that we're going to share with you in just a few moments. I want you to know that there really are no perfect solutions as we face this unprecedented pandemic here in Fairfax County Public Schools. But I can tell you that we will work together and have the solution that is right for Fairfax County and for Fairfax County students and families. By the way, the purpose of tonight's town hall is to listen to you, and you have already responded. We've had over 70,000 responses thus far to our community survey. There's still a little bit more time this week to do that survey, and we encourage you to do so. We've had already 5,000 comments and questions ahead of tonight's town hall. That's right, 5,000. We're not going to get to all of them tonight, but we will have an opportunity to share some of them along with phone calls coming in and emails coming in, and to really help give you the additional information that you need. If you have comments that you don't get to hear tonight or see tonight that you want to share with us, please visit our website at our webpage, Return to School at FCPS.edu. And you can find that on our website at www.fcps.edu. So without further ado, let's get to the presentation. We're going to cover it really quickly, but it's important to help set up some of the questions and comments you may have tonight. First of all, guiding principles for our reopening plans. We want to ensure safe learning and working environments for students and staff. Safety is our top priority as we look at return to school. We want to maximize in-school student learning experiences as allowable by state guidelines. And you're going to hear us talking about 6-foot physical and social distancing wherever possible, which is the guideline in phase 3. We're still in phase 2, but we are looking forward and hoping that we will be in phase 3 as the summer progresses and we get ready for the beginning of the year. We want to ensure that all students receive instruction that meets state and federal standards and have the necessary supports for success in place, which include access to technology and connectivity, social emotional wellness and health supports, and additional supports to meet needs of special populations like our special education students, our English language learners. We also want to provide training, time, and support necessary for staff to prepare for successful reopening, giving our teachers and staff the training they need to support our children. And we need to continue, like we're doing tonight, to be proactive and clear in our communications along with translations. We have translations going out in 8 major languages for the survey I've just referenced, and continue to do all we can to better communicate with families and students. I want to talk a bit about the governor's guidance around recover, redesign, and restart. He shared this early last week, and quickly a brief summary. He announced a phased reopening plan for Virginia schools aligned with the business plan. We are currently in phase 2 for Northern Virginia that just went into effect this past Friday. They are aligned, as I said, with the Forward Virginia Blueprint, which is the business and community plan that went in effect actually for phase 2 a few weeks ago on June 12th. School divisions are required to deliver new instruction for the coming academic year. All work next year will be graded. Communication or community mitigation strategies like physical distancing, enhanced cleaning will be required across all phases. And school divisions will have the flexibility to be more limited in their in-person instructional offerings than each phase allows based on determinations of local public health data. And we've had a great partnership. We had Dr. Gloria and Dr. Ben Schwartz with us at the work session just yesterday, providing a lot of that health information that's been just tremendously helpful. And Lorraine is with us tonight to help answer some of the health questions. You also can see here with the reopening guidance that there's phases. Phase 1, 2, and 3 for Virginia schools. We're in phase 2. You can see the information there. It focuses on certain students that could come back in phase 2. It still talks about the limit for a 50-person gathering with social distancing. That 50-person limit is still in place. And we have been working, of course, to do our graduation celebrations, our graduation photo ops following the governor's guidance. We see too in phase 3, if we can go back just a moment on that, to see that in phase 3, which we're hopeful will be the case when school starts, that all students may receive in-person instruction, but the focus really, again, is going to be on that 6-foot distancing to be maintained to the greatest extent possible, which limits the number of students we can have in a classroom or on the school bus, and we'll be talking about that in just a few more moments. Thank you for sharing these 3 phases, and I hope this information is helpful to you. You can find more information about that on the Virginia Department of Education's website as well. A few other quick key points that the governor shared. We are not just following state guidance, but following CDC guidance, the Center for Disease Control. And all of our work is built around CDC guidance and decision rules. Divisions will be required to conduct daily health screenings of students and staff for symptoms and history of exposure. And they can be conducted with self-reporting forms, and the guidelines will apply across all of our phases, phase 1, 2, and 3. Face coverings were also discussed with the governor. They should be worn by staff at all times when 6 feet of social distancing cannot be maintained. Schools should encourage, and we will be talking about this in more detail and have with the school board, the use of face coverings for students as developmentally appropriate and in settings where social distancing cannot be maintained. We are going to have a stricter standard, or we're proposing that to the school board, around students wearing face coverings when they're on the bus for transportation, and certainly when they're transitioning in the hallways, if they're in schools, for example, at high school, where you might be moving from class to class. Face covering guidelines will apply in all 3 of the governor's phases. The impact of COVID-19 on children is one of the big topics in our community, and I'm going to turn it over to Lorraine, who's done a lot of look at this issue, a lot of research on this, and will be sharing the latest information that we have around this for COVID-19 and our young people here in Fairfax County. Lorraine?
Thank you very much, Dr. Brabrand. Before I begin, I'd like to acknowledge Dr. Ben Schwartz. He is the Director for Epidemiology and Population Health at the Fairfax County Health Department, and he has developed these slides for us, so I did want to acknowledge that. What we do know about the impact of COVID-19 on children is that the rate of infection is unknown, and I know that that can be frustrating for a lot of parents and community members, but the reason for that is that there just is not enough data. Children often present asymptomatically or with very mild symptoms, so they are not tested. Additionally, there's no data available to us at this point, or it's limited for the serological testing out in the community. Even with the international studies, while they know that there are some limited cases where students or children have been the index case, it is really unknown as to how that actually spreads throughout a family. We also are aware that the new syndrome called multisystem inflammatory syndrome of children, otherwise known as MIS-C, is rare, but it is a very serious consequence of COVID-19 in children. It usually happens post-infection, but is characterized by several systems being affected, such as the kidneys, the heart, neurological, etc. As I've said, we've had a few cases in Northern Virginia, but not that many. The impact of COVID-19 on children often goes beyond the physical. As we know, within household, as stress increases, so do family dynamics change. Next slide. So as Dr. Brabrand has already mentioned, we have a very wonderful collaboration with Fairfax County Health Department. And in that collaboration, they do provide support and guidance to Fairfax County Public Schools. So what we can move ahead with and expect is that they will share and they will track the COVID-19 epidemiological data with Fairfax County Public Schools. That data will also be shared with the Virginia Department of Health, and that data can help to make informed decisions on the state level. Also, there will be conduction of contact tracing and case investigations, including the focus on Fairfax County Public Schools. When there is an association between a positive case and a student or staff member at Fairfax County Public Schools, the health department will actively keep us appraised and the community appraised. There will be a tremendous amount of communication between the families and the school system regarding any types of cases of COVID-19 that are found to be positive in the school system. We will also be working collaboratively with the health department regarding outbreak investigations and guidance. The definition of outbreaks and public health responses are currently still being discussed in full by the Virginia Department of Health, but they may include classroom-wide quarantine or school closures. That will be case by case, and it will be data-driven and in collaboration again with the health department. So how does a school decide how to move forward with the COVID-19 pandemic? The CDC has provided a decision tree, and Fairfax County Public Schools, in collaboration with its partners, have gone through the phases of each one of these steps. So initially, when you consider reopening, you must look at what the state is saying. And as Dr. Brabrand has already mentioned, we are in phase 2 and we're ready to move ahead. We looked at, were we prepared to provide PPE for our students and staff at risk, and we are prepared to do that. Also, in terms of hygiene, we are prepared to move ahead with making sure that our students have plenty of soap and water, breaks to wash their hands, our social distancing, our masks when developmentally appropriate. If students do not have a mask, FCPS will be providing that for them. And of course, our 6 feet of social distancing. Enhanced cleaning is also part of that. And with respect to, is ongoing monitoring going to be in place? As Dr. Brabrand has mentioned, yes, that will be an ongoing part of our decision to open. We will have screening tools in place. What that actually will look like is still being determined as we look at all of the governmental guidelines, the Virginia Department of Health, the recommendations from the Fairfax County Health Department, and of course also our VDOE. But with all of that, we do feel that we are prepared to open and provide a full measure of monitoring for our students.
Thank you, Lorraine. I really appreciate that. So we want to talk about 3 scenarios for you to be thinking about as you look at return to school, as all of us look at return to school. Scenario 1 is virtual learning for all. That would mean no students in the buildings, and staff would have access, though, for instructional purposes following health department guidelines. We would be doing 4 days per week with synchronous, that we call synchronous learning, face-to-face learning over the computer. And 1 day a week, we would have asynchronous learning. We call that sort of on-demand learning. And this would be what the typical schedule would look like, Monday through Thursday, a sample pre-K2 schedule. It would start in the morning around 8:30 with some teacher-directed instruction. There would be specials. We would have some instruction dedicated for ESOL and special education interventions. Then there would be a break. And then in the afternoon, some teacher-directed time as well as student choice activities. Friday would be an opportunity for some independent or collaborative work, as well as some time for our teachers to do planning. The virtual learning for all for secondary would really mirror the typical Bell schedule for our students, simply in an online environment. And we would have classes a little shorter than in the normal school day when we are on our block scheduling. So you'd have about a 45-minute class that follows the school day with office hours in the early afternoon with additional questions. Fridays would be independent work or collaborative work for kids to do and dedicated planning time for staff. Scenario 2 is in-school learning with the health and social distancing that is talked about in Phase 2 and in Phase 3. Again, we are in Phase 2 now, and we are hopeful that we will be in Phase 3 when school begins. This would include things like health monitoring protocols, that daily health screening form or lanyard, or some way that we're going to communicate with parents, with you all, about, is your child asymptomatic and have they been exposed to anyone with COVID-19 symptoms? We'll need daily communication and daily protocols to make sure that we know that. Social distancing guidelines in place, again, that 6-foot separation wherever possible and limiting mixing of student groups. Doing that as well with our buses. Collaborating with the health department, as Lorraine already talked about, to make sure we're monitoring outbreaks, to implement the health and safety protocols we need. And it's important for you to know that the health department, frankly, has had a system in place in our schools for years to monitor things like tuberculosis and other communicable diseases. Unfortunately, we're having to bring that system in now as we face the pandemic of COVID-19. In scenario 2 with health and social distancing, we have two models. One is the proposed 50% option. That would have our kids in school 2 days of the week, face-to-face. They would have in-person, in-school work. And then on 2 days, again, let's take one cohort, group 1. Monday and Wednesday, they'd be in school. Tuesday and Thursday, they would be online doing asynchronous work, assignments from the teacher, recorded videos, other materials that teachers have provided. And then on Friday, it would be an intervention block for kids in either group who would come in for additional help. That intervention would happen in the morning, and then we'd have teacher planning in the afternoon. So the 50% model means students would come back either on a Monday and Wednesday or on a Tuesday and Thursday. We would divide it by alphabet. We don't have that division done yet, but it would be done in our own best thinking around a pyramid approach so that schools, elementary, middle, and high, would have families with kids, of course, at different levels going to schools on the same days. Monday, Wednesday, Tuesday, Thursday, and some kids would be asked back on Friday morning for additional intervention and supports. In the 25% option, the same idea that we just shared with you, 2 days a week with an additional intervention day on Friday, would simply be 1 day a week for face-to-face with that teacher, and then on Friday, the additional interventions for students that need it. That is our scenario 2. Scenario 2, I'd like to talk a little bit more because there's a lot of attention around this as a likely scenario for our school system being in Phase 3 if the governor has us in Phase 3. So I'd like Mr. Plattenberg to talk a little bit about how scenario 2 looks from a classroom perspective and even from a transportation perspective. Mr. Plattenberg, can you share a little bit about that?
Absolutely. Thank you, Dr. Brabrand. So when we took a look at these examples and we were looking at scenario 2, what we did was we looked at our average school classroom layout, and really that was a square footage. And in the slide presentation, you can see that what we provided was the width and the length, and we took a look at the actual spacing within that school. Our average class size of 28 students as budgeted. When looking at this to provide 6-foot spatial distancing, we went ahead and took a look at that both at the elementary or the primary and the secondary. So we looked at the elementary and we identified how we could do that, and we looked at the secondary as how we could do that overall. Each of these, however, in our conceptualization of these scenarios, are going to have to be operationalized. So in this coming up Friday, we're having meetings with our principal groups to identify and have conversations with our principals as to how to execute that, because each and every one of our schools have all been designed to be inclusive, opening, having additional space, learning space that's really collaborative social spaces. So we're going to have to work with our individual principals to identify how that space actually is going to work. But when we did the conceptual, we came up with this and the spatial relationships to ensure it. In terms of transportation, what we did was we took a look at the number of students we transport. We transport over 140,000 students each and every day in a regular school year. So trying to keep the social distancing on our buses, we went ahead and identified how we would do that. And we took a look at the impacts of doing one student per every other seat and one student per seat. So when we talked about providing social distancing as best as possible, to the most greatest extent possible, when we transport our students, we're going to be looking at this in terms of how we can actually deliver our students. And this has impacted our bell schedules, which is on the next slide. When we talk about the transport of our students, of those 140,000 students that we hope will be coming back at the beginning of return to school, we looked at what the current bell schedule was and the impact of having to provide some form of social distancing on our buses. In order to do that, our bell schedule had to have some basic adjustments, and we needed to add otherwise additional buses and drivers. We currently have had a shortage of approximately 80 drivers each and every day. So that has been a challenge to begin with, and it takes usually 9 months for the fabrication and delivery of a school bus, and the procurement of it as well. So we really looked at those as not being really viable options. In order to provide that social distancing, though, you'll see there are some changes in there in terms of the current bell schedule versus the proposed bell schedule, and those adjustments that we'd have to make. All of this is to ensure, to the most extent possible, we can provide social distancing for our students and also safety for our drivers as well and our staff, to make sure that the wayfinding for our students that are being dropped off is provided for in a safe, maintaining those social distances, and also trying to, as much as possible, take into consideration any type of conflict between the kiss and rides and where our students get dropped off in buses. We also provided time for our bus drivers to actually clean their buses in between runs, and some of the safety protocols that we're working with our staff on. So that, Dr. Brabrand, is what we have in terms of some of the functional or operational sides.
Thank you, Jeff. Before we go on, I want to pause on this because I think it's an important piece of information to share with you. You just saw Mr. Plattenberg show a classroom with 6-foot social distancing in effect. In a typical normal operation, the distancing in an average classroom in Fairfax County is about 18 inches, a little short of 2 feet. What we're trying to do when we're showing you these options, trying to maintain 6-foot physical distancing wherever possible, means you can't put the exact same number of kids back in a classroom like a normal school year and have any ability to have that 6 feet social distancing in place. So it really is trying to balance the ability to have capacity in the classroom with the amount of space between students. I just want you to understand the difference between what it is in a normal school year, around 18 inches, a little less than 2 feet, to having 6 feet. So how do we put in kids into the classroom and an ability to have them separated at 6 feet and maintain that social distancing as they receive instruction? That is the challenge. You saw, too, with the transportation, the 2 bus scenarios. Again, we're talking with the board. The one that is best to operationalize transportation for the thousands and thousands of kids is 1 per seat. And we are talking about a strong requirement, not just a recommendation for students to have masks when they're riding the school bus. And so those discussions remain ongoing with the board, but I want to call both of those things to your attention. That is all scenario 2, where we're having in-person learning at either a 50% or 25% level of engagement during the week. Scenario 3 is about online learning for individual medical need. We know, and the state provided guidance, that we needed to have the opportunity for our students and staff with the threat of a medical need or severe illness to be able to provide learning for them or flexibility for them. So we certainly would work with our elementary and middle school cohorts to create online support for the students with online FCPS teachers. And in high school, we would use our existing online campus and also virtual Virginia. We know that there are documented medical needs out there for our students and staff, and we want to work with them around that. Those schedules would again mirror much of the instructional schedule for the virtual scenario one that we shared, with 4 days of face-to-face learning and 1 day of additional activities done sort of independently. So I wanted to share with you again scenario 3. I believe that is all of our presentation. And now let's go to questions and comments for the rest of the town hall. Again, I hope this information is helpful. More of this information can also be found on our website. Please share this information with family and friends and coworkers. We want everybody to see what our best thinking is, because we have to make a decision, honestly, by the end of this month about the way that we're going to set up for school in the fall, so that we can get started with the implementation plans to do so. The first question is, why isn't there an option for a full-time return to schools? Well, that's a great question. I was trying to just share a minute ago. We want, and under perfect conditions, we would want all of our kids back in school every day. The governor has provided the statewide plan for reopening schools, and there is not a phase 4 yet. We have asked about that, and I believe that a phase 4 will ultimately come. But at this moment in time, we are working with the phases that we have received. Phase 3 clearly gives guidance for 6-foot social distancing in schools to the greatest extent possible. Our current social distancing under normal classrooms, a normal classroom experience is 18 inches. That is way, way short of the 6-foot social distancing that we can do. So if we're going to be safe for our students and staff, as we've said we're committed to doing, we have to operate in-person schools at a less than 100% capacity. And that's why we have the 50% and the 25% plans. The next question is around, what health metrics are you using to determine when it's safe to return to schools full-time? I'd like to ask Lorraine to answer that question for the community.
Thank you, Dr. Brabrand. I appreciate that. There are many governmental agencies that we will be looking to for providing our health metrics as we return to school full-time. That would include recommendations from the Fairfax County Health Department, the governor, the Virginia Department of Health, and we will use those statistics, again, data-driven, to determine how we will move through our phases and how we will change operations for school.
Thank you, Lorraine. I'd like to share, too. We talked a little bit about this yesterday, and please go and look at our presentation that we did to the school board. The health department brought a lot of data around what's going on in Fairfax County, sharing about new cases that are being tracked every day, hospitalizations that are being tracked, the rate of folks being tested positive. And I want to remind all of you, too, around that the health department is committed to working with us as we resume school to do that contact tracing. If there were to be a student or teacher that tested positive for COVID-19, that we would be doing those investigations to determine who they had interacted with. And that's so important, because one of the things we're finding out nationwide and around the world, successful countries who are rising to meet the challenge of COVID-19 have fully robust contact tracing as part of the strategies. And we're so lucky and fortunate in Fairfax County to have a commitment from the county and the health department to make sure that that's going to happen. One of the comments we have is my kids' hallways are not even 6 feet wide, and I feel that ESOL students should be in school the most, because they would benefit most from in-person teaching. All others should be online and could make appointments with teachers if they need help. Well, we certainly appreciate all of the feedback. Again, we're getting thousands of folks with comments. One of the things that we've talked about already is that when 6-foot social distancing cannot be maintained, like in a hallway, we would ask students or require students to wear masks during those transitions, just like we talked about requiring students to wear masks when they're taking the bus. So that would be part of it. We're also looking at a focus that if things were to get worse, which we hope that they don't, that we would put a priority on our kids that most need to benefit from in-person teaching to continue to come to school. Now we're going to take a phone call for the town hall. Welcome, caller.
Hi, I just want to thank you, Superintendent, the board, and everyone at Fairfax County Public Schools for working so hard in the middle of a global pandemic. You've been asked to, you're building an airplane while you're also flying it. And I just think you've, really risen to the challenge. But my question is, I watched the board meeting yesterday and the plan today, and I'm asking about the option for full-time or even full-time remote learning and teaching and teleworking for teachers, staff, and students who are at higher risk. But I didn't hear anything about family members. So, for example, one of the board members had asked that, he's a spouse of a teacher and he has asthma. What kind of accommodations would be available to them? So that's my question is staff and teachers and parents, if we have someone in our family who's at high risk, would they also be able to access that online full-time option? For example, I have a kindergartner who is high risk and a second grader who is not. So obviously my kindergartner is going to get my second grader is going to get my kindergartner sick. So will my second grader also be permitted to access the full-time virtual option? And if I and other parents like me decide that the county can't ensure the safety of my children and I have to withdraw them, how is that going to impact my local school and the school district that I love and I'm committed to? Will that affect the budget? Will funding disappear? Will federal funding disappear? And my school happens to be Title I, so I'm concerned about that too. Sure. If I had to withdraw because I couldn't access that option.
We don't want to have you withdraw. We want to figure out ways to make you and your family feel safe. I don't have Dr. Nixon. Dr. Nixon actually was on a town hall we did with staff last week, and I wish she were here to go through it. But I will say this. We're certainly sharing out with staff information about all of the flexibility that they have. As far as families, the CDC guidance does list a set of conditions, and I don't have that with me today. I think we would need to work with you to figure out how we could, in any way possible. I guess for scenario 3, you're saying if you have one child for the medical need, could you work with your other child? And I would tell you that we're committed to working with you on that kind of situation. I don't know, Ms. Troughton, if you had anything else you wanted to say on that topic at all. Do you, or have I shared it about as well as I could?
No, I think you've
okay.
covered it. Thank you.
So we would work with you. You have one child with a medical need, and you would need additional flexibility. I'm sure we could work with you on that. And I want to say one just other thing. We really are committed. This is a time that you all in Fairfax County have spent years and years investing in Fairfax County Public Schools, and we want to do everything we can to return to school and emphasize our commitment to continue to serve you even during this pandemic. So we are working very hard. One of the most important things is being sure that as we offer options, that we have the capability and capacity to provide what we're offering. And so we know that medical needs are the priority of the state. They are the priority in our guiding principles, and we have to be sure that we can meet the needs of those medically fragile students and staff first, even as we look at what additional options we can have for others. So let's go to another phone call. Thank you again, caller. Hi, how are you?
I'm a Fairfax County teacher, and I'd like to know what exactly the enhanced cleaning means inside the school buildings. If I'm being completely honest, all Clorox wipes, hand sanitizer, everything that I have been provided in my 7 years of teaching has come from families. I never get anything from the county, so I'm wondering what changes are going to be made to hotspots throughout the school and also in the school? Who's going to be cleaning student desks, student supplies, things like that? And are we going to see a change in the supplies that we are given?
That's a great question, caller, and I want to let Jeff Plattenberg share a little bit of information about that. Some things I didn't even know about in terms of cleaning supplies that we have had that kills the coronavirus. And so I'm going to let Mr. Plattenberg talk a little bit about how we're currently planning to clean and what additional help and supports we may ask for others, because it's going to be a collective effort to keep our schools safe and clean for our students and staff.
Thank you, Dr. Brabrand. Yeah, I really appreciate this call because in the past, teachers were really reliant upon their families, their students' families, to provide things in the classrooms pretty much, especially during the cold and flu seasons. What we had not provided is the hand sanitizer. You're absolutely correct. So our plan is we've already had delivery of 30,000 bottles of hand sanitizer. We have another order that's out for another 15,000. We're hoping and we're anticipating that this is a temporary issue that we're going to have to be working through, and hopefully it won't be too much of a long duration, maybe a quarter perhaps. I would prefer to have sooner than that. But in terms of your cleaning, so we've altered our custodial cleaning within the buildings to make sure that they do the high-touch areas, the doorknobs, the crossbars walking in and out, and their roles are going to be scaled back from doing some of the exterior perimeter so that the daytime porter custodians can be doing those high-touch areas. Additionally, we also are going to have heavy-duty cleaning through the evening. The increased monitoring of the bathroom facilities and cleaning where is necessary, all in conformance with the health department and the CDC guidelines and the governor's return to school. In addition, there is one component that you mentioned. We are all in this together, and we will be working together. Does that mean that we'll be asking our faculties, our staff, our administrators, our custodians to do more? All of us? Absolutely. But what we're doing is we're at least trying to take a look at how we can leverage that together to make sure that we're providing you with supplies you previously had to provide yourself. So thank you for that question. Very good one.
You know, Mr. Plattenberg, on this, because this is a big question, I think the public knows a lot about hand sanitizer. They know a lot about soap. But I'm going to ask you something else, Mr. Plattenberg, if you can. There's some chemicals or some solutions that we actually have given our custodians that are very effective against the coronavirus. Could you talk a little bit about that and give the community some additional detail?
Yeah, absolutely, Dr. Brabrand, and I apologize for not mentioning that, but we provide a Virex disinfectant, right? And that Virex disinfectant kills the coronavirus. We've been using it for a long period of time. We've had relationships with the health department and the health director and Lorraine Trout and her staff. The whole team has been working over the years for any type of MRSA, any type of coronavirus that we've addressed, not COVID-19, but it does and has been proven to kill the coronavirus. And that's what we use every day.
No, thank you for sharing that. And one of the things I want the community to also know, in our budget that we shared with the school board yesterday, we're putting our money where our mouth is when it comes to enhanced safety and cleaning, and we're providing custodial overtime for our schools. So there's additional time for custodians to do the additional work to keep our school facilities and offices clean. Let's go to another email. Will children get a temperature check before they board a school bus? Who will administer it? This is something, honestly, that we're continuing to look at around how we do transportation. It is not a current recommendation at this point. It is something that we will continue to look at. One of the things we've learned from the health department is that the temperature of a child itself is not a 100% guarantee that the kid has coronavirus, and that many kids present with no temperature, even if they were to have had COVID. I don't know, Lorraine, if you wanted to add anything else. So the temperature in the public's and in the media, we hear that the temperature check is one of the things that many places are using, but it is not a fail-safe procedure. Mm-hmm. I don't know, Ms. Trout, do you want to say anything else about that?
Yeah, that actually is correct information, Dr. Brabrand. While temperature is a good indication, it is not a fail-safe indication, and there are other screening tools that can be used together with a temperature check that would actually give a better outcome for our students.
Mm-hmm. I do want to also say, though, we are purchasing additional thermometers at our schools. It will be a tool, But I'm not prepared to say this evening, nor have I recommended to the school board, that a temperature check is going to be done on every child when they enter a bus or in a school. It needs to be part of a set of tools that we have to make sure that our students and staff are safe. Let's go to an email. In order to allow for social distancing within schools with a full-time return, have you considered utilizing trailers and other rooms like the gym to host classes? I'm going to let Mr. Planenberg talk a little bit about the facilities configurations. We have looked at these larger rooms, but it's not as easy as it sounds to have 100% of students in who can't be. Remember, it's 50% of students that wouldn't be in classrooms. Is there room in these other large spaces in the school? The short answer is no, but I'd like Mr. Planenberg to talk a little bit more about those challenges and what we are trying to do to look at how we can maximize capacity using those larger spaces. Mr. Planenberg.
Again, thank you, Dr. Brabrand. Yeah, we've looked at all of the spaces. When you take a look at Fairfax County Public Schools, our physical plant footprint is over 27 million square feet. That equates to about 5 pentagons. Unlike the Pentagon spaces are all similar when you go in that facility, the office, the cubicles, etc. Of our over 220 schools and centers, 198 schools, we have different space, different size, and what we call different size chassis. We have some that are prototypical, meaning they're similar. If you have an Aldrin, a Bonnie Bray, a Cub Run Elementary School, for example, those all have a similar chassis, much like the secondary at the high school with Springfield, Lee, and so forth, those that were built in certain eras. But as I mentioned, being built in certain time frames, even though they've been renovated, a lot of the spaces are unique for those individual schools. So yes, we've taken a look at not only the gymnasiums, we look at every space, the trailers, the question was asked. We've looked at every type of space to make sure that we're going to be able to accommodate that 50%. That's why I alluded to earlier our need to work with our individual principals and see how they program at the local school level. We can look at it from a conceptualized way, but as we continue to evolve to address the concerns that have been raised, which we really do appreciate, and we want more of those questions so we can provide answers to our community, so we can investigate all of the scenarios. We will continue to look at each and individual space to see what we can accommodate and where we might have to provide some classrooms because the actual space may be too small for any type of learning. So thank you for that question.
No, thank you, Mr. Planenberg. The next question is, if I choose the all virtual version, can I change my mind during the school year and send my child to school? What we shared yesterday with the school board around this virtual option for students with medical need is to make a choice for the entire school year so that we can properly staff. And the reason is we need to be able to do contracts for teachers during the year and have them teaching in either a virtual role or full-time. So that is our recommendation at this point, that it would be a year decision in doing it. So thank you for that question. Another comment is, I recommend FCPS should start strong and ease back if necessary and give parents the discretion to decide. Well, as I've shared, we certainly all want to start strong, finish strong, and have all of the year a strong year for Fairfax County Public Schools. It is about safety. It is about following the guidelines from the governor of the Commonwealth of Virginia and the CDC guidelines. And we have to balance the guidelines that we have along with the priority of keeping our folks safe and secure. Some folks might say, well, forget the guidelines and just go ahead and send everybody back and see what happens. I am responsible. I am responsible, and I know that I am, for the health and safety of students and staff in our schools. So the responsible thing to do is listen to our state officials, the governor, the state epidemiologist who are providing the guidance, and then work closely with our local health officials for their guidance and support to make the right decisions. And that is back to, there is no perfect solution right now. We're trying to come up with the best solution that maximizes in-person instruction, that maximizes student safety, and provides options where we can provide them. Let's take a phone call for the town hall. Thank you, caller, for calling in.
Good evening. I am very appreciative of the safety measures that are in plan for implementation in the fall, such as reduced capacity. I also appreciate your honesty with sharing that maintaining 6 feet in distance at all time is not plausible. And because of those challenges, you've said students will be required to wear masks on school buses. but we keep hearing that students will not be required to wear masks in classroom. It'll just be suggested. Without students wearing masks, I'm concerned about students and teachers quickly becoming at risk, and then teachers see a new set of kids the next day and put them at risk. My question is, if we know that students are unlikely to constantly maintain that 6 feet in distance from each other and from staff, and that teachers will be required to wear masks when they're within 6 feet of someone else, why won't students be required to wear masks in the classroom?
Right. Well, one of the things from the state is the recommendation that the state has provided is developmentally appropriate and strongly encouraging students to do so. And I want to be clear, we are going to strongly encourage kids to wear masks throughout their time in the classroom, not just the requirement for the school bus or, say, when they're moving between halls, moving in the hallways. But I also want to be clear, and one of the things the state talked about, even with teachers and staff members, if you're farther than 6 feet away, the teacher, for example, could be up at the front of the class, and if they're farther than 6 feet away from students, may remove the mask for a portion of time. So it really is a balance. If students are in their seating and their seating is 6 foot social distancing, there may be the opportunity for students not to have the mask on, even though we would recommend its continued use. One of the other points I just want to share that we shared a little earlier is all of these are mitigation strategies to lower it, and we are continuing to look at data, including, I believe, data that came out today in the Washington Post, that transmission among students remains very low in the latest international study that's been done. So we're going to continue to look at all that information to help our guidelines, and if we get different information, we can always even go more strict and make it be a requirement in the classroom at all times. But it is a balance, and that's what we're trying to do here, is find that very important, but maybe it feels sometimes an elusive balance of safety, but also the practicality. Is there a kid at one moment in time during the whole day who may put their mask down while sitting at the desk 6 feet away? Yes. And what is that in the overall risk to other students? If it's temporary and only done when they're 6 feet away, it certainly isn't the same kind of issue than if the student is not doing that when they're 1 or 2 feet next to a student in the hallways or when boarding a bus. Now let's take another phone call from the town hall. Caller.
Hi, Dr. Brabrand. This is Amanda Campbell. I'm the Vice President-elect for Fairfax County SEPTA.
Hi, Amanda. How are you?
I'm good. How are you?
I'm fine. Congratulations.
Thank you very much. After listening to yesterday's conversation, there was a lot of talk about a concentrated effort on keeping children in the same classroom all day, especially at the younger grades. And a concern we have with special education is the students who spend part of their day in a general education classroom, and then the students and then split their day with a self-contained special education classroom. How is FCPS thinking that they are going to handle that changing of classrooms, or are parents going to be asked to choose one placement over the other, or what is FCPS thinking around that?
Yeah, that's a great question, and I'll be honest, that detail didn't come up yesterday, and it hasn't been brought up yet to me, but let me tell you what my initial thinking is. When you go to the governor's document, phase 3 says consider restricting mixing. I think we really need to look at decisions around what's best for students, both social-emotionally, health-wise, and also instructionally. For example, in our high schools, if we considered restricting kids to one class for high school, we would lose tremendous opportunities for kids to get to their elective programs and to be able to go to the course that's at the appropriate level for them. I think we've got to balance, and again, you're going to hear this word of balancing. I think we have to balance the needs of our special education kids for when they can be in the general education curriculum and in those team taught classes or pushing into another class, that we give as much flexibility as possible to do it. So I want to have as flexible of a point of view on how to do that. It's something I'll take back to my team and try to get further clarification so that you and other parents like you can make sure you're making the right decisions and you have the right information now as you move forward for return to school. And I want to be clear, we need to work to try to be able to provide as many opportunities for students to have the same opportunities, even in a reduced capacity scenario too, to have the normal integration of them into elective programming, into general education classrooms, if they're special ed, as in a regular school year. So thanks, Amanda. Now an email, how is virtual learning in the fall, or how will virtual learning in the fall be different from what was offered in April and June? Well, one of the things, we did a lot of lessons learned and we shared them with the board yesterday. One of the things we recognized is we need and will have in the fall more face-to-face time virtually than we provided this spring. I accept responsibility for the lessons learned this spring and acknowledge things that we could have done better. And the reality is what is done cannot be undone. As a leader, you take the mistakes that you've learned from and do something different and better in the fall. So we are going to have additional face-to-face learning. We are going to have more teacher training than just 1 week prior to spring break. And we're going to do continued monitoring, having our principals and our region assistant superintendents checking in frequently with schools and with parents to make sure that the expectations we've shared with you are happening in every Fairfax County Public Schools classroom. Let's take one more email. If a child becomes sick while at school, how are we ensuring that he or she gets picked up in a timely manner? I'm going to let Lorraine talk a little bit about the process for that.
Thank you, Dr. Brabrand. When a child becomes sick at school, we would like to have parents or guardians pick their student up within a 60-minute time frame. We understand that especially in the Washington, D.C. area, that cannot always happen. So what we are hoping that we can partner with families to have them complete in totality their emergency care cards and their health information forms so that we have the name of a relative or a neighbor or even an older brother or sister that has permission to come and pick the child up. So that for a couple of reasons, we don't want the little one or an older child to stay not feeling well in a strange place. They'd like to be in their own home, et cetera. And also we want to, again, mitigate the spread of any kind of illness to the other students that might be in the health room. So we really are looking toward the families to partner with us and to provide information for contacts if they know that they cannot possibly pick that student up within that 60-minute time frame. Thank you.
You know, that's a great point, Lorraine. I want to just share with the community the timing for having when a child is sick. The sooner that child is out of the school environment or out of contact with others, the safer everyone is, including the student. Emergency care cards have been with Fairfax County Public Schools for years and years, even when I started teaching here in Fairfax over 25 years ago. Now more than ever, I am asking parents and community members, or I'm asking parents, please fill out that emergency care card information as soon as possible. Have it updated and accurate so that we can reach out to you if there's an issue, if there's a COVID-19 issue, or if there's any other issue. But this year, now more than ever, when a child is not feeling well, we are going to be isolating them from other students and staff at the school and returning them at home to the appropriate supports that they need. And if they are a kid experiencing COVID-19-like symptoms, we will be recommending quarantine. Got a comment here about listening to Tony Fauci, who we all are listening to around the country on NPR, and he mentioned schools holding outdoor classes as an approach this fall. Tony didn't call me prior to the town hall tonight, by the way, to share that information with me. I'm reading it for the first time. I was encouraged by this prospect, as many, if not all, of our schools have ample outdoor space to accommodate outdoor instruction. I hope you're considering it as you look at reopening, planning, and strategizing. Yes, this is something that came up with our school board yesterday about how we can utilize our outdoor space, and we certainly will. I do want to remind folks, too, what sounds like a good idea, and it is, and the good Dr. Fauci has a great idea, we also have to be prepared to deal with the issue of storms and temperatures being over a certain level and kids being uncomfortable outside as one of the other factors as we consider the great opportunity of having more outdoor time and not just being in the classroom, or even more capacity. So it's a great idea, but we do need to be able to have contingencies around when students would need to be inside for safety or security reasons, for weather reasons, and for health reasons if there's high temperature or humidity. It will be something we'll continue to look at. We want as many of our kids back as safely as possible this coming fall, and we're going to continue to rely on our local health officials, our state health officials, and yes, listening to Dr. Fauci and others from the CDC and the National Institutes of Health to help us with our return to school planning. We'll take a phone call now.
Hi there. I'm a parent of 2 elementary school kids. My question is regarding the social distancing guidelines, specifically for special education and K through 3rd graders. Can you talk more about how this recommendation is developmentally appropriate for those kids, especially when our kindergartners and 1st graders are learning those key social skills that will carry them through, and thinking about them going to be 6 feet apart the entire day for an 8-hour day?
Right.
Thank you.
No, it's a great question, and let's be candid, because we've got to continue to be honest and truthful with one another. I cannot guarantee any day that every child will be 6 foot social distance at every moment. It's just not an expectation that I can promise. In fact, I think there may be times where we have to just admit that kindergartners may be, or 1st graders or elementary kids, any kid, may be closer than 6 feet. What we would want is to be sure that those kids were engaged in all the other mitigation strategies, wearing a mask, frequently washing their hands, so that they remain as safe as possible. We also, because you mentioned special education kids, we have some kids we know with significant needs that require hands-on or high touch for a lot of the day. For those classrooms, we are working with Mr. Plattenberg to provide additional PPE or personal protective equipment like gowns or face shields that may be able to support them in those classrooms. But we recognize that kids are not going to stay 6 foot social distance at all times. In fact, the state guidance in phase 3 says wherever and whenever possible, and that will be our goal as we look at return to school for next year. Let's take another phone call.
Hello, good evening. My question is regarding the social distancing as well. I teach an elective class at the high school level, and as you know, the numbers of students in elective classes tend to be pretty high. And I wondered if you guys gave any consideration to possibly reducing class sizes and hiring additional staff in order to cover that, or possibly extending Jefferson contracts to teachers in the middle and high school level so that we could thin the number of students in our classrooms, but still maintaining the teaching of our own students and our own courses.
Sure, that's a great question. And, one of the things Mr. Plattenberg talked about is we're going to look at each school, school by school, class by class, and look at some out-of-the-box ideas. Perhaps it's a Jefferson contract. Perhaps the classroom you're in becomes an outdoor classroom or a space that's larger in the school than the current classroom you're in. And we're going to ask teachers and staff to be a little bit more flexible. When I first started, it was, this is my classroom. Nobody else can even come in. I was a teacher on a cart. This year, we are all in this together, and we are going to ask staff to be more flexible about the space they use and when they use it. And we may, to be able to, again, to get more students in, large spaces may be more heavily used. The choral teacher might have to share the classroom to allow some other teachers that have larger classes in so they can be 6 foot social distanced. And I know that Fairfax County Public School staff are going to continue to be incredibly professional and collaborative and work to make these scenarios work. So we'll put all things on the table with the goal of maximizing the number of kids that can come in while being 6 foot social distanced. One more email here. Is there any thought to year-round school? The calendar came up yesterday with the school board, and we're going to continue to keep all options on the table. But I have to tell you, the calendar is something that we approve almost a year in advance. People make decisions around life events, weddings, trips, anniversaries, and we want to try to be sure that if we have to make a calendar decision, that we give as much advance notice as necessary. One of the things I may not have said as well yesterday that I will work to do better moving forward is we may have, and we talked about flexibility, that whether we need to change the calendar versus whether we need to change the scenario. If things were to get worse, I know some colleges are looking at an extended winter break. Could we just move from scenario 2 in person back into scenario 1 that is virtual learning for all? And I think that is one of the real things that we would be working to do so that we could provide flexibility within the framework of the calendar versus creating a whole brand new calendar. It's not something we're taking off the table, but we are not anticipating changes to this school year's calendar now. By the way, for the community, we will be sharing with the school board, I will be sharing with the school board this Thursday my recommendation for the 21-22 calendar, which has some new features that I think are going to be very positive for the community as we celebrate equity and diversity of our students and families in our community. I hope you'll take a look at that calendar, and we'll be asking for your feedback on it in the weeks ahead before it's approved in July for the 21-22 school year. Let's take an email. Is there a role for Northern Virginia Community College to help with online learning? There absolutely is. I want you to know that President Ann Kress, who really joined NOVA in her first year and now faces the challenge of this pandemic, has been a great strategic partner with Fairfax County Public Schools. She has been working with me and with Dr. Presidio, our Assistant Superintendent for Instructional Services, around ways to expand dual enrollment opportunities for our kids. We'll continue to partner with NOVA throughout the school year and beyond to find more ways that we can create dual enrollment opportunities for all of our students. We'll take a comment now. I'm an employee and I'm the mother of a Fairfax teen. The teens need school, friends, sports, and activities. They need it now. Their mental health is suffering. I understand. I'm an employee of Fairfax County Public Schools, and I have a Fairfax County teen, 2 of them to be specific, and I know their needs and their challenges much. I don't know your family's challenges, but I know my own, and I know that's what we all want. We are working on a return to play scenario that we shared yesterday with the board. As you know, that physical conditioning will be allowed for Fairfax County kids starting June 22nd. We are working closely with the Virginia High School League, who will be issuing guidelines around return to play very soon. We just need to be sure, like we've talked about with in-person for school, that it's done in a safe and responsible manner. And I'm really proud that we got through 4th quarter to continue to work and support our coaches and all of our folks who did additional activities in addition to teaching. Yearbook sponsors, drama and debate sponsors, and all of our spring sports continued to celebrate with kids, to do closing ceremonies for the season that was cut so short. And I really want to thank all of our coaches and extracurricular and co-curricular teachers for all their above and beyond work during this pandemic this past spring. One phone call from the town hall. Caller, how are you?
Hi, how are you? I'm a first grade teacher in a Title I school, and my question is about kids who are already coming to school sick. So I know it's happened in my class and my teammates' classrooms. Even when our kids have a temperature, the parents often can't pick them up because of work, and they remain in the clinic. And I'm concerned about these students coming to school and exposing others, including teachers, with COVID. So beyond the survey that you mentioned, what is your plan to prevent this?
Right. Thank you. I'm going to let Lorraine share a little bit, and then I may offer a few comments after Ms. Troughton has shared her comments.
Thank you, Dr. Brabrand. That's an excellent question. And again, we don't want students coming to school that are sick. We know that sometimes the students do need to stay in the clinic longer than we would like them to. But again, we are really trying to work with parents at this point and community members so that they understand that COVID-like illness is important to be taken care of, and that our students should actually be sent home as soon as possible so that they don't infect others. However, that being said, if we do have a student that is in the health room for an extended period of time, we would have someone there in assistance to take care of that child, and they would most likely have a mask on in place as developmentally appropriate.
I want to also just share on that. This is about the culture in our school system. And the reality is, prior to the pandemic, sometimes we did have folks who brought their kids in even when they didn't feel well. I'm sharing with you tonight our expectation, my expectation as superintendent to every parent and as a parent myself. If your child does not feel well this coming school year, that child should not come to school. I repeat that again. We have to create a new culture this school year and moving forward that when your child does not feel well and is presenting symptoms, flu-like, COVID-19-like, they need to stay home. It truly is a matter, a serious matter, for the health and safety of our students and staff, and we need parents to be partners with us in making sure that happens. It's absolutely a worry because it's happened in the past, but we have to set an expectation that we don't expect it to happen. We don't ask parents or expect parents to have their children come to school not feeling well. They will be removed from the classroom quickly. They will be in isolation, and we will be doing everything we can to remove them from the school as quickly as possible when a parent or someone on the emergency care card with authorization can pick them up. I want to thank all of you today on this town hall for calling in, for your comments, your emails. We are facing a historic challenge here in Fairfax County Public Schools. But I have to tell you, as someone who has spent my lifetime as an educator, in some ways I feel I was born, raised, and now have the honor and privilege as serving as the superintendent here in Fairfax County Public Schools, that this system can make it work. And we will make it work for you and your children today and every day and this fall. Thank you so much, and have a great evening, everybody. We'll see you soon.